was 42, I was diagnosed with stage 2 infiltrating ductal breast cancer, which is very garden variety. And 2 years later, I noticed that my hip was hurting me, my lungs felt heavy. It's something I never felt before, is weight in my chest, and I was coughing a great deal, and I thought that my cancer metastasized. And I delayed actually going in to find out, but eventually I went in, and my oncologist ordered a chest x-ray, and the next day I found out that they saw something on that x-ray. So I was really, it just confirmed actually what I had thought. And I thought that was it. I have metastasized breast cancer, but I discovered that no, I needed to go for further tests, and I had a CAT scan, a chest CAT scan, and those images were actually put up on a big screen. And my oncologist came in and he looked at them, and then he looked at me and he looked at them, and he said, it looks like it's in every quadrant. I'm sorry, it doesn't look like, you know, it will be a good diagnosis, but we could probably keep it at bay for a couple of years. And I was just like, oh my gosh, all right, that's it. But he kept looking at me in a way that made me wonder. And I thought, all right, now I know I have it. But he said, we're going to have to do a bronchoscopy, something I had never heard about, and it sounded very unfriendly. And I just was surprised during this process that each time it wasn't confirmed. And I didn't know where to go to get information. I felt blind. When I originally was diagnosed, I went to the store and I got a book by Susan Love, which is known as kind of the breast cancer Bible. And this helped me. I mean, every step of the way I knew what was happening. But with late stage, I was in the dark. So I had the bronchoscopy, and on a Friday night, on a hot summer night here in the South, my oncologist called and he said, well, you know, it looks like we can't find anything. And he said, I don't want to take you on a roller coaster, but you may not have it. And then I'm like, wow. And then Monday morning he called and he said, look, the team has met and we think we have to go further. We want you to have exploratory lung surgery. And I was like, wow, what's happening? But in order to find out, that's what needed to be done. And when I woke up from that surgery, the pulmonary specialist, the surgeon, was beside me, and he goes, you don't have metastasized cancer, you have another disease, an autoimmune disease called sarcoidosis. And I was just, you know, very grateful. I had my life handed back to me, but I lived for a while, like for, you know, I'd say a couple of months or more, believing that I had late-stage cancer. Getting handed back my life made me feel that I needed to do more about helping others with breast cancer. I had given money to organizations, but I really hadn't done something that could make a difference. And I have a background in writing. I have a background in statistics. I felt I could interview doctors, gather information together, and put together something that would be helpful to other people. And I made that decision literally waking up on the gurney. And it was a long process. It took 10 years, but that book got completed, and in large part thanks to my co-authors who brought the medical information to the table. So I'm hoping it will serve a purpose, that purpose I had needed, you know, to move forward myself when I was diagnosed. I realized how incredibly ignorant I was when I started to research the book. I really didn't know about recurrence. I didn't know there were different kinds of recurrences. I didn't know that the seriousness can vary a great deal. So learning about that helped me recognize that it is very important immediately to just look into any breast abnormality that you might have. But, you know, it's not that you should let it go, but it's less important if you're concerned that the cancer has moved into an organ in your body. And knowing the difference in how quickly you have to go for help was one thing that was very useful for me to know. It was also incredibly useful for me to understand better what are the symptoms of recurrence, because anyone who's had cancer lives with the specter of it coming back, and any little like pain I had in my hip or a headache, I'd have it, oh no, I have brain mets now, you know. And to learn that there's patterns that metastasized cancer will follow, and the symptoms can be known. For example, it's not just an occasional twinge in your hip that's the problem. Is it over time getting more painful, more painful, more painful, not going away? It's not usually intermittent if it's cancer. And with headaches, I learned that typically, although not exclusively, they happen late in the afternoon. And so just learning about the symptoms of recurrence could allay a lot of my fears when I wondered if I had metastases. I also learned, and I was so grateful to learn this, I saw the statistics and the curves about when recurrence likely occurs, and it occurs so prevalently in the few years afterwards, and then precipitously the graph drops, so that, you know, a couple years out, your chance of getting a recurrence from most kinds of breast cancer, not all but most, is very small. And so it helped me begin to think of my life differently. You know, right afterwards, I couldn't decide. I wanted to buy some land for the future, and I thought, I don't know if I should do that. Do I really care to like go up for a promotion at work, or should I really put my energy into other kinds of things? So as I realized as time goes out, my priorities changed. So I was very grateful to learn things like that. I also was introduced to a number of websites in this research that I didn't even know existed. And these websites are in the book. There are 88 resource boxes, and within that have different labels. And within those resource boxes are a number of links that have been carefully culled so that people can find out, okay, where do you get the latest scoop about a supplement? Has it been tested, and in what ways? And so you can make a better evaluation about whether or not you want to take this substance or not. I also became more critical, actually, too, of allopathic medicines, because I learned statistically there's a great difference between relative and absolute effectiveness of a drug. And although this is something that I think has to, for most people, be studied a little bit, we have in the book an appendix that talks about how you can learn to get the absolute or the relative difference of effectiveness in different drugs. And that will help you decide if you want to be on it. There are research studies, and these studies are quoted in the book, that the more patients are proactive and understand treatments, the more they can make wise decisions and collaborate with their doctors rather than just be told, here, take this. It's much more empowering, and you feel like you are a participant in getting well. The hardest things you can do is to inform yourself so that when you go to an appointment, all the information that's coming at you at an appointment can be overwhelming. And if you go in with some basic idea, for example, if you have late-stage cancer, it would be helpful to understand how the doctor is determining how long you are going to be on the treatment, and to know that you have many options for treatment. It's helpful to understand that treatment's more varied with late-stage cancer, and that you need to be proactive, even if you don't want to know a lot about treatments. You need to be proactive about how you want to live your life, because some doctors will be very aggressive and want to, throw everything at the cancer possible. But there's trade-offs there. You may not be leading a very good quality of life in that circumstance. It depends on what the treatment is. And maybe you would rather have the opportunity to travel and to enjoy the taste of food, to be able to go on a hike and appreciate life in certain ways where if you're under a heavy treatment you wouldn't. You would have to let your doctor know if your cancer is progressing. Do you want to end up in the hospital in your last days fighting the cancer to the very end? Or would you rather move on to more comfort care and have drugs that will ease your pain, allow you to be at home and and perhaps enjoying things in life rather than be focusing on doing everything to prolong every minute. All cancer patients actually who have progressive cancer need to think about that. And the book itself is more comprehensive and more detailed than you can get on websites. There are some fabulous websites out there. Breastcancer.org, I wish had been around when I was diagnosed. And the National Institutes of Health and the National Cancer Institute have just a plethora of information that I didn't even know about till I was researching this. So these links are really helpful. They're not going to come up if you put in breast cancer right away. So one of the great values of the book is that, for example, if you want to know the very latest in breast cancer, we have a link that will bring you to the annual breast cancer conference. So you can go as in-depth or not as you want. But I want to mention that the medical accuracy of the book was carefully looked at by both Dr. Shaw and Dr. Daniels. So I want readers to feel very comfortable. I did a lot of research as well, but they confirmed everything, added to everything, corrected things that they felt needed corrections. There is one last thing I'd like to say, and that is for the people who are watching this who have been diagnosed with breast cancer, and especially those with late-stage breast cancer. I wrote this book for you, and I hope that it will make a difference in your life, give you the information to empower you, and a lot of comfort. There is a lot in the book that deals with psychological and even spiritual issues near the time of death, or when you're afraid of recurrence or what the future might be. I hope the book will offer you a lot of help.